Hi students, myself Jincy, lecturer from Emmanuel College of Pharmacy. Today we are discussing about the topic dosage forms. The dosage form are the carrier or medium through which drug or molecule are delivered at the site of action within the body. Every dosage form is a combination of drug and non-drug component called excipients. The dosage forms may be classified into two categories, namely drugs, which means active pharmaceutical ingredients, then excipients. Then drugs, a chemical substance used in the treatment, cure, prevention, or diagnosis of disease, or used to otherwise enhance physical or mental well-being. Then the need for dosage form, accurate dose, protection, for example, coated tablets, sealed ampules, then protection from gastric juice, masking taste and odor, placement of drugs with within the body tissues, and sustained release medication, controlled release medication, optimal drug action, and insertion of drug into body cavities. This means rectal and vaginal, and use of desired vehicle for insoluble drugs. Then classification of dosage form. Dosage form may be classified into four types: solid, liquid, semi-solid, and gas. The first one is solid dosage form. The solid dosage form may be classified into two types: unit dosage form and bulk dosage form. First one is unit dosage form. Unit dosage form may be classified into four categories, namely tablet, capsule, powder, and pills. Then bulk dosage form, which may be classified into five categories, namely fine powder, granules, dusting powder, insufflations, and dentifrice. Then second one is liquid dosage form. Liquid dosage form may be classified into two types, namely monophasic and biphasic. Monophasic dosage form classified as syrups, elixirs, liniments, lotions, drops, mouthwashes. Then biphasic. Biphasic dosage form of liquids may be classified as suspensions and emulsions. Then third one is semi-solid dosage, which may be classified into two categories, namely external and internal. External, which means ointments, creams, jellies, and pastes. Then internal, which may be classified as two, namely suppositories and pessaries. Then gas, classified as two types, namely inhalers and aerosols. Then tablets. Tablet is a compressed solid unit dosage form in the round, oval, or solid, or oval or square, which is ingested orally. Then capsule. Capsule is a medication in gelatin container. Capsules are classified into two types, namely hard gelatin capsules and soft gelatin capsules. Then dusting powders. The dusting powders are applied in a very fine state of subdivision to avoid local irritation. Then pills. A small rounded solid unit dosage form containing medicament and are intended to be administered orally. These are now rarely used. Then lozenges. Solid oral dosage forms are comprised of sugars and gums. These are used to treat mouth and throat infections. Then granules. Granules aggregates of drug particles which can be made attractive and tasteful by incorporation of coloring and flavoring agents. Then insufflations. Medicated powders meant for introduction into the ear, nose, throat, or body cavity by insufflation. Then dentifrices. Dentifrices used for cleaning and polishing teeth with the help of toothbrush, available as powder or paste. Then snuff, inhaled into nostrils for its antiseptic, bronchodilator, uh, and decongestion action. Then effervescent granules contain medicament mixed with citric acid, tartaric acid, and sodium bicarbonate. Then syrups, monophasic liquid dosage form, 66.6% weight by weight sugar solution as per Indian Pharmacopoeia. An 85% weight by volume sugar solution as per United States Pharmacopoeia. Then elixirs, sweet aromatic preparation and are usually colored and contains ethyl alcohol 4 to 40%, water, glycerin and flavoring agents. Then drops, not diluted and administered in their original form with a dropper. Then mouthwashes, used for treating mouth infections and maintaining oral hygiene. Then lotions, liquid preparations applied externally without friction, applied directly on the skin or with the help of toxins. Then liniments, liquid preparations applied externally with friction or by rubbing, cannot be applied on broken skin or alcoholic and oily solution. Liniments produce soothing and analgesic effect. Then linters, viscous liquid preparation used for cough relief. Then gargles, concentrated aqueous solution which are diluted with warm water in prophylaxis or used for cough relief. Suspension. A biphasic liquid dosage form in which finely divided insoluble solids are suspended in a liquid medium. Types for suspension may be classified in two types, namely flocculated suspension and non-flocculated suspension. Then emulsion. A biphasic liquid dosage form containing an internal phase in the form of minute droplets dispersed in an external phase. Two types of emulsions may be classified as oil in water and water in oil type. Then ointment. Semi-solid preparations with a greasy texture and are applied to the skin. Ointments are either used as emollient or are applied to the skin as suspended or dissolved medicaments. Then pastes are semi-solid preparations applied externally. They differ from ointments and gels as they contain large amount of finely powdered medicaments. And then pastes, semi-solid preparations intended for external application on skin. Jellies, transparent or translucent non-greasy semi-solid preparations mainly used for external application. Then suppositories, biphasic semi-solid dosage form of medicament for insertion into body cavity other than mouth, usually through rectum. Then pessaries, biphasic semi-solid dosage form of medicament for insertion into vagina, used for treating bacterial and fungal infections and vaginal dryness. Thank you.